This presentation is brought to you by the E.S.I Foundation. Over 50 years of research towards curing cancer the natural way.
So E.S.I, exceptional, sophisticated, integrated, healthy dentistry. And how do we do that? We do that three different ways. One is use of our knowledge for oral biology. Two is high tech. And three is using holistic approach. So let's talk a little bit more about that. To oversimplify things, there are really two main diseases in the mouth: cavities and periodontal disease or gum disease. But we can't treat what we can't see. So I think it's imperative to use advanced diagnostic techniques so we can figure out what the patient has at the right time. Obviously, it's easier to treat something early compared to late. So this is where technology comes in. Now, I'm not a big fan of x-rays, but sometimes we need something. We need a baseline. And we like to use ultra-low dose radiation doing a cone beam CT scan. So with one scan, low radiation, we can see a lot of information in the head, neck, and oral cavity. Everybody nowadays has digital x-rays, which is 90% less radiation than the traditional x-rays that we used to have years ago. But there's more than that. With the use of light, we can see a lot more. There are special intraoral cameras. Think of them as pen cams. And they flood the tooth with light, and we can capture it with a video camera, and it actually shows us little microfractures, hidden decay that we can't see from an x-ray. So now, without using any radiation, we have better diagnostic abilities. There's other cameras that we use in the mouth to take normal photographs. But there's different settings and different magnifications that show me hidden inflammation that I can't see with the naked eye. In another setting, it shows me hidden cavities. And then to take it a step further, we have a special laser that goes into the nooks and crannies. We call them pits and fissures of the teeth. And again, they show me early signs of decay that I can treat quickly, efficiently, easily, and painlessly. So that gives us a great advantage for patients to take care of things early. We believe in minimally invasive dentistry. Minimally invasive, basically, in my eyes, less dentistry is the best dentistry. Does that make sense? The other thing is salivary analysis. How come one person brushes their teeth 3 times a day and they still get cavities, they still have gum disease? And you have other people that don't really brush their teeth all the time and they don't have any issues. Well, we want to look into it. So with a salivary analysis, maybe their saliva is a little too watery or a little too thick, or maybe they don't have IgG, which is an immunoglobulin, something that protects against disease, inflammation, decay. So I want to know early. What if their pH is too low? Acidic pH causes inflammation, causes cavities. So now we can use oral biology. Maybe we can use a calcium paste that can remineralize the tooth, make the pH more alkaline, and free the patient from inflammation. Again, minimally invasive, using the knowledge that we have of oral biology. Other things that we can do: essential oils. Everybody in this room knows about that. We're all the same type of demographic. That's why we're here. We're looking for human optimization. Well, the way that I see it is oral optimization. So there's specific essential oils that can minimize inflammation and really help people out. So obviously we're all for that. Xylitol. How many people have heard of xylitol? A naturally occurring sugar that cannot really be metabolized by the harmful bacteria that we have in their mouth that causes gum disease and or cavities. So xylitol is a natural sweetener that we can use in the form of a mint or a chewing gum. And now, as you're promoting more saliva, that's your defense against bacteria that can cause either of those diseases. And because they absorb this mineral, this nutrient, they can metabolize it, and we can effectively kill them. Other natural things that we can do is ozone water. Ozonated water is a fantastic thing that kills single-cell organisms, viruses, bacteria, fungi, but will not harm human cells. So that is great to use for both of those diseases, particularly periodontal disease, gum disease, which can wreak havoc not only on the mouth, but the mouth is attached to the whole body. So now, because it's so vascular, it goes into our circulatory system, and now it can go somewhere else in the body. If you take the soft tissues that we have in our mouth, gums, the lining of the cheeks, and you unfold it, it's as big as your arm. If you had an infection as big as your arm, would you ignore that? Of course not. So it's very important to have good oral health. So other things that we can do is, like I said, we can use mineral to remineralize teeth. If you have the beginning of a cavity, and we can measure that, you might be a good candidate to reverse that process. How amazing is that? Simple, low tech, but highly effective. So we're all for that. Things that we do with periodontal disease, gum disease, which can cause loose teeth, bad breath, and then eventually, when teeth become very loose, we lose those teeth and we have to replace them. Well, we have traditional treatment, which is just to mechanically debride and clean those teeth, and you come in frequently for cleanings. But what if we need something more? In the old days, we had to do surgery. Now, again, minimally invasive means we try to avoid surgery. Some cases we have to do it, but we'd like to avoid it. Other alternatives that we can use are laser treatment. And I've seen some amazing results with laser treatment. Laser is the use of light, focused energy, that promotes healing. It literally causes biostimulation. So we're helping guide the body to heal naturally on its own. We're recruiting these cells and chemotactic mediators that can actually reverse this disease and promote bone growth in the areas where we've lost bone, and tissue, right? Gum tissue, healthy tissue. And other things that we can use, like I said before, we can use ozone to prevent and maintain a healthy environment in the mouth. Oil pulling. I'm sure you guys have heard of oil pulling before. It's a mixture of different types of oils. Tea tree oil for one, sesame oil is another, and a little bit of peppermint. Again, all holistic, natural approaches. And what that does, you have to keep it in the mouth for a good 20 minutes, is it literally pulls these harmful bacteria from the deep pockets around our teeth and gums, and now we can literally just spit them out. So it's a nice way to do it. Not the most easy way to do it, but it's a nice, healthy way to promote gum health, which I think is absolutely great. Coconut oil. I'm a huge fan of coconut oil, and that's definitely one of the oils that is mixed in there. Thank you for that. Excellent question. Go ahead.
What can you do for very sensitive gums? Is there anything?
So the question is about sensitive gums. There's many different things that we can do for sensitive gums. The most easy thing to do is peroxide. Salt water is another one. Peroxide breaks down into water and oxygen. And the types of bacteria that cause sensitive gums, inflamed gums, are anaerobic bacteria, bacteria that hate oxygen. So in the presence of oxygen, we naturally kill those bacteria, and we're on the road to recovery. So that's an excellent question. I'm glad you brought that up. Let's keep on going. When it comes to bacteria and causes of disease, one thing that we want to do is we want to control the growth of bacteria. Probiotics is a great way to control that. And that's a double-edged sword against bacteria. It controls bacteria that will cause decay and also bacteria that will cause periodontal disease. Think about this. Freeze-dried bacteria that are harmless. It's a pill, you put it in the mouth, it dissolves, and now you have these harmless, good bacteria that are competing for the same nutrients that the harmful bacteria are using, and now there's not enough to go around, so the harmful bacteria die. A nice, easy, natural way to control the environment of the mouth and to promote health. Again, minimally invasive. We believe in co-diagnosis. What does that mean? I like to have my patients involved in their diagnosis so they can see what I see, and they can be part of the decision-making process. So it's great when you have a big screen TV in front of the treatment room, and I can show you these photographs, these enhanced photographs, literally almost like a Doppler weather map of where we have areas of demineralization and areas of good mineral in the tooth. And now we can make a decision together and go over all your options so we can customize your treatment for your needs. There's no cookie cutter approach. Every patient's different. And I like presenting all the information, and we can come up with a decision together because we're literally a united front. Let's go into some definitive treatments. So I talked a little bit about oral bio, advanced diagnostics, and holistic approach to dentistry. But what about in a case where it's a little further more advanced and we need to do treatment, whether it's a filling, a surgical treatment, God forbid an extraction, and replacing teeth. Well, if you have a small cavity, small to medium, we can use resin to restore that tooth. So when we need to do a filling, we can use a natural material to replace that, to restore that tooth. It's a small to medium filling. Teeth are made of different substances, namely dentin, which is a little bit more organic. Okay, so it's about 85% organic. And then you have enamel, which is 98% inorganic. So it's really hard, stiff material. So instead of putting one material in there, we actually layer it, putting something that mimics dentin on the deeper portion of the cavity, and then on the outside, something that's really hard and can withstand the grinding and the chewing. That's more mimic like enamel. So we have studied the way that the enamel and dentin behaves, and we layer it in a biomimetic way, in a way that mimics nature. If it works for nature, it should work for our health. It should work for our mouth. But what happens when I need to do something bigger? Well, we have inlays or onlays. It's something made out of porcelain, which again mimics nature, and I can use a computer that scans the tooth. Instead of taking an impression where we put material in the mouth, it scans the tooth, and with this video, I can actually design and mill out of a block of porcelain something that day. So in one appointment, an hour or less, we can have a custom-made crown or custom-made filling for that tooth. Same technology, you scan it, it takes about a minute and a half. I can actually send it to my lab in California, and a few days later I can have something for multiple teeth, or a full arch restoration, reconstruction, if you will. I can use the same technology to scan the mouth and create Invisalign. So now I can do orthodontics without an impression, and I can create these clear aligners to get a nice, straight, beautiful smile with the most natural way possible. So again, a combination of holistic and high tech. And in other areas, we have to do something a little deeper. What if we have to do a root canal? And I know there's a controversy when it comes to root canals, but if they're done the right way, triple disinfection, use of lasers, photoacoustic energy, to really thoroughly disinfect the tooth and seal it, a hermetically sealed root canal can last a very, very long time. And people say, well, I don't know, I heard a lot of bad things about root canals. Let me give you an extreme example. My 9-year-old son, if he falls and he cracks his front tooth, I'm not going to be too quick to remove that tooth. And when you're in our chair, you're family. So the way I think about it is, if you were my son, what would I do? And that should speak volumes to our approach to dentistry. Now, surgical things. So what if you have to have a tooth removed? Well, if we want to be a good candidate to have a tooth replacement, maybe an implant, we can do grafting. Now, some people are very sensitive about grafting. Where do you get this mineral that you're going to put in there and we're going to grow bone? Is it from a cow? Is it from another human being? Some people are very sensitive to that, and I totally agree. But we have the ability to take some peripheral blood, spin it, create this plasma-rich fibrin, and then we put that. So that's the ultimate in holistic. We're using your own body, peripheral blood, to remineralize and guide the body to create bone where we're missing bone. So I think that's incredible. I'm still fascinated about that. Last thing I want to mention, and then I'll take a question or two, is what about phobics? Patients that have avoided the dentist for 10 years or more because they're so afraid. To me, phobia is a condition. And patients tell me, I'm so embarrassed, I'm sorry, I hate the dentist. Don't apologize. Would you apologize if you had diabetes, high cholesterol, or high blood pressure? No, it's a condition, so we treat that. Whether we treat it with nitrous oxide, which is sweet air, just to take the anxiety down, or an oral anxiolytic, or the ultimate, which is IV sedation. And now, in one visit, we can take care of 10 years or more of dental neglect because of a phobia or disease. So again, when it all comes down to it, what we're about is healthy dentistry, a healthy approach to it, using everything that we have. You know, we have Eastern medicine, Western medicine, and everything in between. You've heard of the expression, the best of both worlds. I want the best of all worlds, with holistic, high-tech, and our knowledge of oral biology.